So I want to show you cardiopulm just briefly. Imagine every technique the students are going to have to learn about cardiopulm from examination to treatment are all in your cardiopulm app. So we built this because my chair who teaches cardiopulm says, hey, the students are having a hard time. They have no context. They don't know what type of patients these are for. So we purposely built it very similar to the orthopedic apps where you would have, and I'm going to show you briefly here. So for those of you who don't know, all of you now have faculty login. So when you sign in, you should be able to put in your email, and we have sent you an email about your password. So if you notice in the cardiopulm app, the most common conditions that they are going to learn about or have to learn how to treat are here. And you can use the clinical findings videos as a way to give them context. This person has congestive heart failure. She is fatigued. She has swelling in her legs. So we use this.
Well, I have been fairly active all my life, but lately I have been so tired.
So she's complaining about swelling, and here are some risk factors. Here are some reported findings that they have. And when you look at the physical exam, you can see that typically even the key findings video would be useful for both the PT and PTA. Not because the PTA is going to be doing the exam, but it's relevant to see in a moment, how is this patient different from your restrictive lung disease person? Right? So you have these little clinical reasoning videos that I think are quite useful. And from there, here is the common testing that is typically done. So specific to this patient is peripheral edema assessment. Of course, you have your typical vitals, your lung auscultation. Now, how the professor uses it in class, she says, guys, we are learning certain techniques this week. Here are some physical exam techniques that I want you to look at before class. We're going to look at ABI, blood pressure, chest mobility, for example. And so the students will watch it before class, and then they'll reference the app when they go into class. So you have these kind of quick access panels where you have all the interventions that you're generally going to teach. But I think related to this idea of how do you create context, it's valuable to go back into the pattern, all diagnoses, choose a pattern, and then talk about, one, what were the clinical findings of this patient? What may be the pathophysiology behind why this person is having this problem? And then discuss. These are the things that, remember, you learned in lab: inspiratory muscle trainer, incentive spirometer, some progressive resistive exercises, upper extremity and lower extremity. What are some precautions you should watch out for when you're doing resistive exercises? So I think this allows you kind of to, in a very quick way, build context, create some connections, and then move on. So that is the cardiopulm app.